callers and not necessarily those of this station, its staff, management, or sponsors. Are you ready? It is your time to take a few moments from your busy day to unwind, be inspired, and listen to the psychic insights of your host, empowerment psychic, Hallie Elise, a top 100 psychic, speaker, and author. Off air, be sure to connect with Hallie at HallieElise.com. And now, the Hallie Elise Show.
And happy Monday to everyone. We have a wonderful show tonight. We are going to be joined by Elite Home Health Care Services and Premier Concierge Care Management. How are you ladies doing tonight?
Good. Awesome.
I feel this feminine energy in the room. I've been doing the Ask the Expert show, and it's a lot of men. You know, it's the first time I've been surrounded by a lot of strong women. I'm liking the energy.
Good.
So I'm joined by Ketsia from Premier. And I got your name right?
You did.
And I've got Jacqueline Kelly here, or Jackie Kelly.
Either one is good.
Okay, and Michaela. So tonight we're going to talk about getting old. Nobody wants to talk about getting old, right?
Right.
But it's happening as we speak. So what are you noticing, guys, out there for the aging population? What's happening? Was it changing? Are people healthier than they used to be? Or do you find that people are needing long-term care earlier?
Yeah, I mean, we all are aging, as you mentioned, and there's no getting away from that. Every second we age. But particularly the population 65 or older, we are seeing that, it's really multiplying. In fact, the U.S. Census Bureau reported that by the year 2030, we are going to have about 60 million people age 65 and older. So that being said, we do have to take a lot into
consideration. That's a lot of seniors out there getting those discounts, isn't it?
Yes. A lot of the seniors. And again, this is our focus, Premier Concierge Care Management, as well as Elite Home Health. And I do want to say thank you for having me on the show again. I was here back in January, and we are back with the same focus because we focus on the elderly population, making sure that we keep them healthy at home and making sure that we are providing the right care and the right services when they need them. So here we are again.
You bring up a good point. Like, I have to say, when I get older, the thing I'm going to want most is to stay home and not be put in an assisted living facility. Wouldn't you agree, Michaela?
Absolutely.
Yeah, I mean, the longer you can stay home, the better.
Correct.
I think I forgot what your survival rate, I'll call it a survival rate of staying in assisted living is. Is it, what is it? What happens? You die within a year, 6 months? Is there statistics that?
I mean, in an assisted living facility, you have a higher chance of living longer. But when we're talking about nursing home, now it's a different story. So that's the difference between the two. In assisted living facility, there are more activity. They focus more on quality of life versus being in a nursing home where you are isolated and there are no activities, and most likely that person is no longer functional physically and sometimes cognitively as well. So we see that they decline very fast.
So
in a nursing home.
I didn't realize the key difference. So you're saying a nursing home it's basically you're at a lower level of functionality.
That is correct.
And assisted living means you're still having some independence within the, living in this facility with other people.
Right. So you get some medical oversight. You can get home health, which...
So we do a lot of the home health in assisted living facilities. So the skilled nursing, you get physical therapy. We can come in and do occupational therapy. We even take care as much as wounds. So if a patient...
Wound care is a big one, right?
Wound care is a big one. So if you develop a small wound, we're able to come in and still take care of you in an assisted living facility.
What percentage of the patients actually develop wounds? Do you guys know? Is it like...
I don't know the percentage, but I know it's
quite high?
a lot.
Yeah.
It's quite high. I mean, as residents get older or they slip or they fall...
Or become diabetic?
They become diabetic. That's when those wounds really become prominent.
Yeah, and skincare is very important because if you're not watching that little small thing, you're not taking care of it, and you're talking about patients who already have multiple medical conditions, so they open up, and if they are in bed all the time, they're not moving around, then you see those pressure ulcers get bigger as time goes by. And once they get to a certain stage, it's kind of like rapidly you can see that it's totally different. So preventative care is really important, which, you know, your
Is that when they
nurses
get
make
MRSA
sure.
and other types of bacteria? That,
I mean, if you have a wound and you have MRSA on top of that, then it makes it even worse.
it's a double
But,
whammy.
Yeah.
It is.
So patients actually can get wounds without, but it's not just because they're not being turned. It's just they're still, majority of the time, they have to be laying down. Not the fault of the caregiver, but it's
Right.
just kind of a nature of the beast.
Right. Sitting in a wheelchair all day.
Lots of times,
Oh,
wheelchair-bound patients are getting the wounds as well.
yeah. So what does your company do for the wound care?
So basically, we are a Medicare certified agency, and we are operated and ran and owned by two nurses who came into the business many years back and wanted to do the best type of home care that they could do.
Yeah.
We're blessed that we are able to send out highly skilled nurses. We have wound care nurses. We have nurses that are high tech that do IVs. We have all different types. They specialize each in their own quadrant, let's say. But our nurses do go out and they assess the wound. They contact the wound care physician. They get direct orders, whatever the protocol is, and they follow them to the T. So whatever the doctor asks for, we try to treat the wound exactly how the doctor wants us to. And we take pictures, report back, and there's a constant communication with the physicians. That helps a lot to
Yeah.
make sure that we get those wounds better. You know, there's all different types of physicians out there, but the wound care doctors, they're staying pretty busy.
Yeah, I imagine. Yeah, and what is your role, Ketsia, with in the relationship here with Elite Home Health Services?
We work very closely together. My services are private care management services, which are not covered by insurance, but we do play a vital role in making sure that the patients are kept at home, making sure that all the care is coordinated, making sure that all the physicians are kept in the loop as far as what's going on with the patient. What I particularly like with Elite is that you have a physician at any time that you need something. Let's say that it's the weekend, it's Friday at 6 o'clock, and there's an issue. Of course, it doesn't really necessarily need to be taken care of in an emergency room, but we need an order from a physician. Then the patients that are already on board with Elite Home Health, we can easily get that done until the patient is able to see their own primary care doctors on Monday. So we really work closely together to make sure that we cover all our bases and making sure that the patient is maximizing care while staying in the community.
That's handy, right?
Yeah, we're definitely one of, we've started this transitional care physician program. We work with a group that actually within the first 24 to 48 hours that goes out, let's say a patient comes home from a nursing facility or a hospital, or even if they're just struggling from the doctor's office, and we're able to come out and actually send transitional care. So it's very specific. The first, it could be you got to be very careful the first 24 to 48 hours to make sure that when they come home, the transitions nicely.
Do they take their medicines?
Are they taking the right ones? And that's a big, one of the big issues that we see is that when they're coming home sometimes from the hospital, they're getting confused and they're doubling up, or they're taking
God.
the medications that the hospital recommended versus what the doctor originally had them on. So with our transitional care program, it's a doctor or a nurse practitioner is out usually within the first 2 to 3 days.
So the doctor actually comes to the house?
It's a house visit. It's like an old-time house visit. So it's
Wow.
great. And
And that's covered by Medicare?
it is. Transitional care is covered by
Well,
Medicare.
they do cover something, do they?
Yeah. Elite has been doing very, very well with our transitional care program. Right.
That's amazing, that you can actually have a doctor on site and cover it through Medicare.
Yeah.
Yeah, and as you guys mentioned, medication management is a big issue because we're talking about an elderly person who's being discharged from the hospital, and they were taking 7 medications before they went to the hospital. Now they're being discharged with 14. So it's kind of like, which ones do I take? So that's where we are not physicians. We do not write orders, but we make sure that we have those physicians in place to look at those medications and to make sure that they are actually taking what they're supposed to be on.
Well, I imagine you see also a lot of dehydration. I know that's a problem,
do.
particularly you're taking medications, side effects, not hydrating well. So it's
Right.
great that you guys are coming out within that period. Now, how long would you typically have a nurse or a doctor come out, let's say, after there's a transition from hospital to home?
Well, that all depends on what the doctor writes. So right now, certification period can be up to 30 days. Normally, up until January 1st of this year, it was up to 60 days. If we
Oh,
find,
so wait, it used to be they could come up until 30 days, but now they've extended it?
well, it actually went the
Oh,
opposite
it did the
way.
opposite,
So
okay.
it was 60, and now every 30 days we're able to reassess them and reevaluate them. So our nurse goes out, does a full evaluation, they check and see what the patient needs, and at that point, we're able to ask the physician for additional services. So if the patient is still in need of some therapy, still in need of nursing, we need to help with the medication. I mean, we have some diabetic patients that are on service, but they need help.
Yeah.
So we're able to do a little bit more. And it all is by the guidelines of the physician and then what Medicare allows. But it's been very, I would say, very, very good with this new transitional care.
Right.
It's nice to have a physician or a nurse practitioner in the home
Yeah.
helping, and they do not step on the doctor's toes. They actually report back to the doctor if they see a discrepancy that needs to be alerted right away.
But if they see interactions between medications, they can also make that suggestion and maybe
Absolutely.
definitely more skilled to see that that's happening than, a regular nursing assistant, a certified nursing assistant who's just going to come in to help, with some day-to-day functioning.
Right.
Yep.
And as Jackie mentioned, because we are seeing now with Medicare, we are not getting as much services at home as we used to. So Premier Concierge Care Management, as a care manager, what we do is that we try to maximize the benefits for that particular patient. If, let's say, that they are no longer eligible to receive home health, so we work with their primary care physician to see if we could get orders for them to go to an outpatient facility where if they are okay with their medications, they know how to take them, they have a caregiver who could do medication reminders, then they could easily go to an outpatient center where it's a different benefit that Medicare covers, because outpatient and home health are two separate benefits. So if we feel that there's a need for them to get continued physical therapy, then the care managers would work with the patient's physician to make sure that we can get orders for them to continue to get better physically.
Yeah, it's another option if you feel like they're not ready to be home on their own.
Correct.
Yeah, she can also identify when they need to come back to us. So if she's out visiting a patient and she sees that, hey, this patient would really benefit from some home health. The patient's having a hard time. It's taxing effort to get out of the house. Patient's probably not going anywhere. They're homebound. They're doing all these things. She can also identify that and then call us in, and we can help the patient at home. So it goes both ways. If she identifies something where a patient needs to go outbound, they can. They can do some outpatient therapy if, we're no longer, like they've already kind of graduated
From that
from
point.
us, and they go back to,
They
she's
can
a-
go back to outpatient. Now, do you guys ever pick up on, like, I'm sure you're out with the patient and you're there for at least, well, you were there 60 days, 30 days. You ever been the first to kind of notice that maybe there's some dementia or Parkinson's or other things going on with the patient that maybe hadn't been picked up originally?
Yes, and the good thing about care management services, not only that we help in care coordination with Medicare services, we also look at the patient from, like, as a whole, not just making sure the medical, we also look at the social status of our patients. So meaning that we see them on a weekly basis, we call them once a week, and we make sure that if there are any type of cognitive deficits or if we see any type of decline, we make sure that we coordinate for them to see, let's say, if it has to be a neurologist or whichever specialty it has to be, we make sure that we continue to monitor them, because as Jackie mentioned, there could be patients that are discharged from home health, but we are still trying to be proactive. It could be probably 45 days and the patient has not gotten any home health, and we see that there's a decline, then we could get them to come back out, being proactive instead of reactive and waiting for the
Waiting for
blood
a
pressure
fall.
to be so elevated, or they falling at home, or they having pressure ulcers, they having wounds, then at that point we are more proactive in making sure that those services come to the patient versus having the patient go back to the hospital, which many times can be prevented.
Yeah, prevention is great, right?
Correct.
When you can actually help a client before something more drastic happens.
Right.
When we come back, we're going to talk about cost. I want to talk about how your services are covered. We know Medicare covers yours, but
Yes.
let's talk a little bit more so that people know what their options are. So why don't you, Katsia, let's start with you. Why don't you remind folks your company name and how to reach you, and then Jackie, we'll have you give your information as well.
Premier Concierge Care Management. We do service Broward, Dade, and Palm Beach, and our contact number is 954-446-7022. I also have a website, it's premierconciergecm.net, where you will be able to find more information on our services, and you can also contact us from the website.
And Jackie?
I'm Jackie Kelly with Elite Home Health, and we are in Broward, Palm Beach, and Martin, St. Lucie County. The Broward number, which is mostly where I'm based out of, is 954-260-9029. And I'll make sure that I have it for the next commercial. I'll make sure I have the Palm Beach number and the Martin number for you.
We're going to take a short commercial break, and we're going to be back.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects. Provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no copayments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
And we are back with Elite Home Healthcare Services and Premier Concierge Care Management. So when we left off, we were talking about the most important thing. How's it going to be paid for? Sounds great. It sounds like an awesome service. But how are individuals going to, let's start with you, Ketsia. How are they going to afford Premier Concierge and their help?
My services are out of pocket only for now. Certain long-term care policies, they do have probably a limited number, maybe 4 to 6 hours. But keep in mind that care management services do not have to be 20 hours a week. Because what we do is, at the beginning, when patients are in crisis, the families are in crisis, we step in. That's when we see the most amount of numbers being utilized, because we are trying to stabilize that family. So once we are past the crisis, we make sure that we are talking probably 5 hours a week. Because we do a weekly visit to make sure that everything is in place, make sure that we reassess the patient, we reassess the home environment, making sure that they continue to thrive at home. And then we call them, and if they have anything that happens, then they know where to reach us. We are open 24/7 for emergencies, so they can always get in contact with us.
That's great. So then what type of long-term care policies kind of use your services, or allow for your services, I should ask?
It really depends on the policy that the person purchases, because each policy is covered differently. We have policies that probably would give a patient a certain dollar amount, and there are others. And of course, the more money you put into your policy from the beginning, the more you get from it.
Right.
But because now care is getting so expensive, if you had a policy, let's say that paid you maybe $300 a day, like 10 years ago, you could get 24-hour care. But now with $300, how much care can you get at home for that?
Right.
So it's really hard to say that this is exactly what it covers. It's basically based on that particular policy, and also when you need to use it.
Yeah. All the stipulations. Is
Right.
there any particular carrier that you would recommend, or just so general?
I mean, generally, it depends on whichever one is cheaper for you. But at this stage, we see that many of the clients that I assist, they've already had it. And many of them, purchasing a policy now is not even an option anymore.
Because they can't afford it. They're too
Not
old.
only that, because they know that most likely this person is going to start using the policy to begin with. So it's going to be very difficult for them to purchase at this point. It
Yeah.
is something that is recommended for people that are younger, 40s, 50s, to get ready for the future.
Plan to be old.
Exactly.
And what about you? You guys use you're Medicare
We're
certified.
Medicare certified, so we're covered at 100%. So there is no out of cost for a patient to get home
So
health.
long-term care won't cover, if they did have a policy, won't cover any of your services, or
Right. Ours is the Medicare side of it. So as long as a patient has a straight Medicare policy, that is covered at 100% to all our services, including the nursing, the therapy. If a patient needs a home health aide for a short period of time at the beginning of when they come out of a hospital visit, we're there. And that is all covered under home health.
that's great.
Yep.
What do you think determines whether a patient can stay at home and get some home care versus putting them in assisted living? What are those signs that you have to look for?
The first thing to look at is the patient's cognition. It's okay to not remember certain things here and there, but when it becomes a pattern, then it's a trigger for us to complete, let's say, a geriatric assessment just to see exactly where that patient is. And once we complete that assessment and we realize that there's no way this person can continue to be at home alone at night, and we can weigh the pros and cons with the family to see which would benefit the patient the most, having a 24-hour caregiver at home or having them go to an assisted living facility. So depending
Could
on...
also be cost-driven as well, right?
Exactly. So depending on, because again, as we mentioned, people are getting older, they are declining, and the average life expectancy right now is 78.93 years. So people are living to be well in their 80s, and sometimes they live even longer. So really what we do as care managers is really assist that family to make the best decision at the most appropriate time, because we don't want to keep pushing for 24-hour care and then in 5 years there's no money. So sometimes these are conversations that we have with them. We help them determine future cost of care, and of course the family makes that determination as to which one would be more appropriate for them based, of course, on financial.
And how does that, let's say, affect the patient? Let's say their cognitive's good, but they still can't be on their own. I mean, do you have to drag them kicking and screaming to assisted living? How does that work? What if they don't want to go?
Most of the time they don't want to go, because we're talking about somebody who's been living in the same home for 50 years.
Right.
So many times, as I mentioned earlier, we take a proactive approach. We start having that conversation. We make sure that the family's having the conversation, because there's no way we can say today you go into an assisted living facility tomorrow.
Or do you tell them you're taking them for ice cream and then you take them somewhere else?
Exactly.
Is that what happens?
That's not going to happen. So it is a conversation as we start seeing little signs of cognitive deficits that we start having with the family. We start talking to the patient about it, because at least if they are prepared and we give them the option to decide what they want in an assisted living facility, because that's very important, because when somebody's packing their whole life from a home to a one bedroom in an assisted living facility, we have to understand that it's going to be very difficult. Many times they feel that they are losing their independence.
Yes.
So making them a part of the decision making and making sure that we take them to the different facilities so that they can also see and be able to make that decision as to where they go, we see that it helps the process.
So they ultimately, as long as they're in charge of their legal still, they have the decision to say yes or no. They have the ability.
Yes, they do. And of course, you don't want it to seem like I'm your daughter and now I'm telling you we must go here.
Or I'm your
like
daughter. Or I'm your daughter-in-law and you're going
Some of these assisted living facilities are absolutely stunning. There are so many of them. I mean, they're like 5-star resorts. It's almost like you're
live there.
We go to so many of them, and they're like beaches. It's like going to a resort where you have all these wonderful activities.
Buffet breakfast.
It's just nice, and you get to see people that maybe you wouldn't normally socialize in your home environment.
Yeah.
So I know that I've been working with a lot of assisted living facilities in Broward, and I can tell you one after the next. It's just more appeasing for the patient to go in, because there's always something to do, and they have movie theaters now. They have all kinds of things that are salons. Oh,
really?
We have seen stunning assisted living facilities here in Broward.
Yes.
Yeah. We've brought some on the air, and I can tell you, I mean, the list of all the fun activities.
We are in Boca.
And the list of fun things that they do are amazing.
Right.
So
Yeah, what kind of activities do you see besides the movies? And
Oh,
of course getting your
poker
hair done?
night.
we see all kinds of different things.
It's not
we
strip
see,
poker, is it?
No, we're hoping not. We're hoping not. All different kinds of activities. They do painting classes. They do ceramics. They do, I've seen some of the assisted living facilities doing like caring for plants and bonsais
that's
and
great.
teaching, and they do all kinds of, all the holidays and all the different activities and events and Mardi Gras night and poker night. We've actually walked into a couple, just we were visiting and we actually stayed and had a great time. So
You bring up a good point, because I think the number one killer of elderly is loneliness.
Isolation.
Agreed.
Yeah, isolation and loneliness.
Absolutely.
So having friends and activities and a reason to wake up in the morning,
Yeah, makes a
you know,
difference.
makes
And
a
they
big
also
difference.
have outings, like they get to pick and choose where they
Oh.
go maybe once a week. So
Shopping
it's not where you're
trips and-
just there.
Oh, they go shopping. They go shopping, huh?
Right.
That sounds nice.
So there are a lot of different activities, and trying to get an elderly person to agree to go to an assisted living facility, we have to show them all the benefits of being there, not just because we could be concerned 24/7. If they're not concerned, then
Yeah.
it's not their concern. So basically we need to show them what these facilities have to offer in order for them to be a little bit more receptive.
Yeah, I think yeah, you've got some variety. But when I was growing up, my great grandmother never wanted to go to the assisted living facility, and it was just such a dreaded place. And it was, well, she won't be with us long if we send her there, so let's try to keep her, home as long as we could.
Right.
But I think the model has changed.
Definitely.
The
And
model
it's geared more towards quality of life versus just this is the last place where you go.
so quality of life. When you're talking about activities, and what else? What else encompasses quality of life?
Quality of life, meaning that they're not in and out of the hospital because they have that medical oversight. They have that nurse that's going to check on them every couple of hours. And they have that nurse who's going to make sure that they are compliant with their medications. Many of them are able to see their own physicians on the site. And for those who actually see, if they have to go out to see a cardiologist who does not go to the assisted living facility, our care managers will make sure that we go with them to the appointments, making sure that we're giving a full report to the physician based on the last time they were there and anything that may have happened. So quality of life is not just the activities, but also keeping them healthy and compliant and keeping them in the community for as long as we can.
I used to hear a lot of problems about elderly patient going to one doctor for this, getting a medication, going to a doctor for this, getting a medication, and then problems.
Right.
What do you guys do that helps mitigate that problem?
Well, on our side, basically, our team of nurses and our clinical staff, they develop an individual care plan for each patient. So what we do is we go in and we assess what their medications, and making sure that we're in contact with, if it's a primary, if it's a cardiologist, we're going to find out what they're supposed to be on and actually stick to a plan. And then we develop that whole care plan for them. So with us, that's how we're able to help the patient, as well as the transitional care physician, who comes in and verifies if this is the right plan for them. So
I guess the pharmacy's also taking measures now too to make sure
do.
that the
they make sure
patients-
it's not interacting in the wrong way, or two medications aren't. And you would be amazed, it still happens all the time.
Right.
That, one physician may not speak to the other physician or the other specialist, and they don't know that they're both giving a medication in conjunction, or maybe it doesn't go together.
Right.
But they're catching it, and it's important to make sure that you have someone just double checking. Our nurses go out and they even help them fill their little their pill boxes in
Yeah.
their cases. So we're making sure that they're getting the right medication at the right time as per the doctor's instructions.
Yeah. I see that Elite also offers psychiatric nursing. So
Yes.
what does that entail?
Mostly with our psychiatric nurses, we care for patients that may have different behavioral issues and may need monthly or weekly injections. So we have a psychiatric nurse.
What type of behavioral issues?
Well, it can be everything from schizophrenia to bipolar. We have multiple ranges of patients.
So
with
now they're
different
elderly and
conditions.
they've, maybe they used to take their schizophrenic medicine on time and then now they're forgetting. And
Right. Right, and there's
Never really
patients
thought
with,
about that,
there's
but it makes
patients with
sense, yeah.
dementia, with Alzheimer's, with Parkinson's. There's all different kinds. We have patients with every different type of diagnosis and behavioral, different issues.
Yeah.
But we make sure that the psychiatric goes out, the psychiatric RN, and whatever medication. Like a lot of times when they're the injections, our psych nurses are actually administering that to make sure that they're not missing that dose and that they're safe and that they're able to stay home and be happy and not have any issues.
yeah. So how often would they have to go out? Probably once a week?
Most of our patients, I would say, get more than a weekly visit. Absolutely.
Particularly if you've got a non-compliant
Yeah.
patient.
Right.
And that particular service is great because many times as people get older, everything is blamed on old age. So the person's prior medical history is not taken into consideration because if you had some type of mental health concern before, just because you're older doesn't mean that it goes away.
Now you got a double whammy. You're old and you've got a mental condition.
Exactly. So we do want to make sure that we are appropriately screening those patients to make sure that we are providing those services that they need. Because again, if they're having a lot of behavior issues, then it becomes a problem where maybe this person cannot be at home anymore. When in reality, if we are able to manage that problem, then they can remain at home.
Have you ever had a patient so non-compliant with medication that you're like, okay, you just can't, is that when you made the determination you can't be at home anymore? We've got to put you in assisted living where you can get that 24-hour dose of medication or whatever you need?
Oh, there are definitely situations with patients who are non-compliant, but again, the patient has to be willing, either the patient or the family has to be willing to make that next step.
Right.
If they are non-compliant and non-willing, patient stays at home. You notify the proper channels and you let somebody know, but there are a lot of patients who choose not to do the right thing for themselves.
Yeah.
So,
Michaela, have you ever experienced clients who, they're elderly and they still want their independence but you as the healthcare provider knows that you have to talk to that child or whoever's basically now in charge of them. Do you ever find that that's a problem?
Personally, I haven't yet experienced it, but I know it happens all the time. You do sometimes get a child or a parent or a significant other always trying to chime in and not really thinking. Sometimes they think they know best, and and I know that they come from a loving place.
Yeah.
But that's our job as professionals to let them know that this is what they need and this is how we can help. So yeah, sometimes we do come in conflict. But personally, I've had wonderful patients and experiences. But I know Jackie, she's been in the business a lot longer than I have, so she could probably touch more base on that. Have you experienced that?
Oh, I've had a whole range,
Because I could see, I'm old and I want to have my way and I don't want you going around
Right.
my back and,
I think the most important thing is that I've always tried to meet with the patient themselves. If their family member is with them, I always include them in the conversation, but I always make sure that I speak to the patient
you
themselves.
show that respect.
I do. And I found that if I go to them first and I let them know these are the services that I provide, this is what we're able to offer, it will normally come out a lot better. It's a lot smoother transition.
Yeah.
If I try to, jump to their significant other, their spouse, it's that trust isn't there. So we have to build that trust with the patient first and get
Yeah.
them to understand that we're here to just help them. And that's all we're here to do. We're here to give them the best service.
You're not the enemy. You're not
I'm
going to take
not.
them away.
No.
You're there to keep them home longer.
And I'm a plethora of information, so I work with great companies like Hetzia's, where I can always have a resource. Like families may not know that there's someone out there that does what she does. So by me being able to inform them on the front end, it really does help. They actually look at it as a benefit.
Right.
Yeah.
And many times all you can do is make a recommendation because it's not an order that they must follow. But again, giving the recommendation means that you also have to explain the benefits of following that recommendation. Because again, people are not going to make decisions if they don't understand the value of what they are choosing to either purchase or what it is that they are agreeing to. So it's very important that we are able to explain those benefits and let them know why that recommendation is being made.
Yeah.
And most times, if we do take the time to provide that little bit of education and people understand exactly where we are coming from, we find that it's easier for them to actually comply.
Yeah. We're going to take a quick commercial break. Why don't you give your phone number one more time, guys? Start with you, Ketsia.
954-446-7022, Premier Concierge Care Management.
And for Elite Home Health, I'm going to give you the 800 number. It is 888-422-3578.
And we'll be back. Great job, guys.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects, provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no co-payments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
And we are back. So this next question I'm going to ask you, I hope my dad's not listening. So when I'm interviewing providers, you know, for like let's say a certified nursing assistant or someone that you're going to use, what are some qualifications you should look for to make sure that you're getting mom or dad the right person?
I do not own. My company is care management only, but I do work with trusted companies in the community that are able to provide certified nursing assistants. They do go through their own background and verification process to make sure that these people are qualified to go into the home. Now, for myself, I do either sit with the family and interview those caregivers based on what I know my patients, what their preferences are.
So the family's in the room while you're interviewing who's going to be taking care of their parent or spouse?
Exactly. So we kind of like do like a panel interview where the family comes in, they ask questions, because sometimes we assume that what I would want for my mom is the same thing that you would want for your mom, but in reality it could be different. So we make sure that we get everybody in the same room and they can ask the appropriate questions. Then after, we could interview more than one caregivers, because we understand there is no one size fits all, because this caregiver may be a great caregiver, but it's not a good fit for this particular client.
Doesn't fit the personality.
Exactly. So these are some of the things that we look at as far as, you know, what the services that the caregiver will be providing are also, it's also important to take that into consideration, because we may have somebody who needs minimal assistance and we may have someone else who needs more than the minimum. So we also have to take all of that into consideration in making sure that we are placing the appropriate person that's going to be able to transfer the patient, to give the patient a shower, not necessarily carry them, but they do have the proper training in making sure that that patient is not going to be falling at home and they will be safe.
Yeah. So minimum care could be just kind of helping prepare the meals and
Correct.
just providing some company and making sure that, you know, their color looks good that day and they,
Right.
like you said, taking their medication, they're staying hydrated. To maximum care is they actually need help actually
Bathing, toileting,
feeding themselves.
everything, yes.
Yeah. Did you have anything you wanted to add to that, Jackie?
Well, no, I guess with us, you know, we do an extensive background check. We go in and we make sure that the patient has a minimal of certain years, usually 5 years in home health experience.
Yeah.
And we make sure that it is going to be someone to give the highest quality of care for our patients.
Yeah.
So that's definitely something that our agency would look for. And even with our nurses, our therapists, even our home health aides, everyone, we do want someone who really does show that amazing personality and that loving touch to be able
Yeah.
to help our patients, make them feel comfortable. because no one wants that nurse to come in who's, being harsh or yelling. And sometimes our patients actually ask us, the family will ask us, well, you got to send mom a real tough one. And it's hard sometimes to figure out who that is, because ours are, they're in this business.
More nurturing.
More nurturing, because we're in a home environment. And I can tell you that I've had many calls from patients who've actually said that, the nurses are wonderful and they've become part of the family, and, they really get to know them. So.
And you bring up a good point, because I have to say, if God forbid I ever had to put one of my family members in a home, you want to make sure that you've got someone who's going to care and not leave them with getting bed sores and letting them sit there and watch TV and drool all over themselves.
Right.
You want to get the right person.
Right. And for my agency, because we are essentially surrogate family members, we do everything that the family would be doing, but with our expertise in care management, we are able to provide that guidance. So we do oversee the caregivers that come in the home. We do make sure that they are actually having activities for that elderly person where they're not just sitting at home all day watching TV. Because my role is to make sure that the patient is getting the most out of the services that they are paying for.
Yeah.
So we do make sure that we supervise them, we monitor them, we make sure that they are able to provide the care and they are able to continue to provide care, even when there are instances if there's a change in level of care, if the patient goes to the hospital, they come back home and they are functioning at a lower level, is that caregiver still able to provide the care that they were providing before? Or what would be the recommendations for care now that the patient is functioning at a lower level, making sure that we are able to get them back to optimal health. So these are some of the things that my care management agency would do.
And if they become lower functioning, that may mean a change of staff or a change of type of individual that you have to use,
Correct.
right?
Yes.
How does that
Definitely.
happen quite a bit?
That does happen sometimes because, again, one of the things that we talked about while we were on break is really fall prevention. Because as the older adult continues to fall, we see more of a decline. And in fact, the Council on Aging reported that 46% of older adults who fall at home, they don't survive the fall.
Oh,
So that's
really? 46%
almost-
don't survive?
46%, almost half of them,
Don't make
those
it.
falls are fatal. So making sure that we are able to provide the appropriate services, making sure that we are matching them with that caregiver who's actually able to provide the appropriate care is very important, because now we're talking about a life and death situation.
Yeah.
And those that do make it, we see that there are going to be recurring falls, because yes, they are afraid of falling now, so it creates a whole new fear in their mind that
Murphy's
I'm not
Law.
going to move now.
Right.
Yeah.
I'm going to sit in the wheelchair all day. So our role as care managers is to provide that level of education to the patient, the family, and also the caregiver, to provide that reassurance that this is what we are doing moving forward to reduce the likelihood of you falling again.
And then them sitting in the wheelchair gets their hip flexors tighter, and then they're going to fall again because they
And
Right.
can't walk.
And wounds, and then we see like our therapists go in and they have to do not only a fall injury prevention, they've got to go in and do like a gait and muscle strengthening training. They have to go in and really get them to come out of their chair and get up and doing the exercises to get them stronger.
Now, most of the time I thought, like with the falls that seniors had, it was they broke their hips. But to be fatal, does that mean they're having a lot of head injuries?
They do have a lot of head injuries because brain injury is very common, and sometimes they may not die from it, but cognitively it changes everything.
Yeah.
And, I recently had a patient who was fine before, and she had a fall, and she had to have a craniotomy because there was hemorrhage in her brain. And now we are seeing this patient does not know what's going on.
Yeah.
And again, we try to be proactive versus being reactive, because sometimes when we try to react to situations, it's a little bit too late.
So do you guys have, your therapists are going out with the fall prevention, and they're working, like you said, on the strengthening and the stretching. So they're really using the time wisely.
Yep, even on joint replacement. So when those hips are, when they have fallen and it is a broken hip, we also do joint replacement training and trying to get them strengthened, get their strength back up. So
Yeah.
that,
So if you see if you see a client who's doing the little old lady, I call it the little old lady walk, where she's looking down and she's barely moving, is that when you talk to the physician, you prescribe physical therapy? Is that
Absolutely. That's a perfect patient because you want to make sure that you're keeping them safe. You're teaching them to make sure they're picking up their feet or not scooting. Or there's so many different.
Or the
stuff.
kyphosis where they have the humps,
The hump, yes.
you know, from
And also, like,
bad
we'll be in
posture.
a doctor's office many a days, the reps that are out on the road, and we're in doctor's offices and different specialists, and we see patients who it can take you almost want to help them get up off the chair because it's taking them a long time to lift themselves, and they're they're shaking and they're stumbling. So those are also times where they can fall, slip, slide.
Yeah.
There's a lot of different things scenarios and things that we look for as well to make sure that we're getting them the right services for them.
I think the worst, though, is the walkers where it keeps them in that poor posture. I saw a commercial, and I forgot what it's called, where they actually had it right. You know, they keep you in an upright positioning. You probably know what it's called, but yeah, I forgot it. So it's like actually helps them where they don't have to stare at their feet and they can keep their, good posture.
And many
know?
times, one thing that people don't know is that those walkers, they are adjustable.
They can raise them up.
So raising them up and making sure you're teaching that elderly person the proper techniques, it goes a long way because they are bending down because their equipment is not adjusted. So this is something that's big for us too, that we make sure that, yes, you have the equipment, but are you using it to, what it's meant for? Are you really making sure that you are using it to your benefit? Because we don't want to give you something that makes you get worse.
Right.
Yeah.
And I'm sure you've seen that happen.
Yes.
So you kind of come in there and then teach how you adjust it for them, which is great.
Yes.
Yeah. How much did that improve their posture?
We have to remember that for new patients that we just meet, they've been doing this maybe 15 years. So it's going to be a lot of re-education and making sure we emphasize this is what needs to happen. And when the therapists go out to the home, and myself,
physical therapist?
Exactly, myself as a care manager who's in the home, there's a caregiver in there. I make sure that they follow the therapy session to make sure that they are able to help that patient in carrying out what the home exercises are. So this is something that is big for us too, where we make sure that the older adult, even though there isn't a physical therapist in the home at that particular time, but they do give them home exercise program where we make sure that they continue to do those, because we all know practice makes perfect. But when we've been doing something for 20 years, it's hard to adjust to that. But, with time, we see that it actually happens.
So is the patient doing those exercises on their own, you said?
The therapists, they do give home exercises.
Sometimes the therapist is obviously there doing the exercise with them, but they get like little homework sheets. And
Yeah.
they're told how to appropriately get up, how to do certain movements, and how to continue getting stronger. That they can do on the days that they're not there.
Right.
Or, if they get a little burst of energy, they can do those exercises. So a lot of times we leave them little sheets and they have those, extra
Yeah.
little things that can help them get stronger.
Yeah. What about how often do you see folks recover nicely from those falls where they've broken a hip? When you guys get involved?
Yeah, I definitely see a great, we have surgeons now that are doing it orthoscopically, and these patients are doing amazing. I mean, I've seen some patients that are back on the golf course within 10 weeks, sometimes
Wow.
even 6 weeks.
Yeah.
I mean, they're standing.
Men in their 80s? And
Yeah,
women in their
I mean,
80s?
Well, they have
Wow.
all different ages. I mean, hips are, sometimes I've seen them as young as in the 50s going out and getting a hip surgery. So.
Oh my gosh.
And it's important to notice also that the post-discharge care is really important in making sure that these patients are able to return to their prior level of functioning, because the surgeon may do an amazing job, but then from them leaving the office, we have to make sure they continue on, because it's not something that happens one time and you fix. So we have to continue to provide the appropriate care at home to make sure that they are going to their follow-up appointments and they are following the doctor's orders in order for them to return to their prior level of functioning.
Yeah.
Yeah, and I would definitely say the post-surgical care is very important. A lot of the patients who are getting the hips or the knee replacements, we can go in, we have the nurse checking the sutures, not only, once the doctor gives them the okay to start doing the exercises and the therapy, we immediately get in there and do that as well.
Which helps
Yes.
a lot.
Yep.
I mean, service at home, you can't beat that, right? You don't have to go to a hospital or a place where there's diseases and infections. You're at home. It's nice.
And the traffic, you avoid the traffic and you
Yes.
avoid all. So home care has its benefits for sure.
They say if
Yes.
you want to get sick, go to the hospital, right? So we talked earlier about, Ketsia, individuals who have long-term care, and and that, have got a policy and they've got a way to pay. What are the options for people who can't afford and need help?
It really is based on a case-by-case basis. Depending on what's going on with that family, I could make recommendation for care. Depending on their financial stability, we can definitely talk about other community resources that they could be eligible or qualify for. So by all means, our care managers do take all of that into consideration in making sure that we are able to assist the patient in accessing community resources.
Yeah. And if you are fortunate enough to have bought a policy when you were younger and get great benefits, how do you maximize the amount of long-term care money that you have versus running out and then going, oh, I'm going to live another 20 years, but I don't have enough money?
Right. I mean, typically it depends on what that policy covers and, the duration of it, because we've had patients that had long-term care, they were in the hospital, they've used it, and then 5 years later something else happens, they're using it again, but in 5 years they are getting less for their services. So sometimes it's really good to look at, the resources that they have and whether or not there are any other resources in the community that they could benefit from long-term. So
you mean to use in conjunction with their policy so they're not draining it?
Yeah, so we can look at different possibilities depending on what exactly that policy covers.
That's great that you help them look at all options.
Yes, I mean, we definitely provide them with seamless care management services for making sure that we reduce them being back and forth in the hospital. We'll help them in making sure that they are not isolated. We help them in improving overall quality of care by making sure that they have the appropriate services in the home. For instance, for long-distance family members, if something happened to your loved one, you don't necessarily have to request time off from work and purchase a plane ticket at that time. We can always go to the hospital. We are there by the patient's side, making sure that when they are being discharged or the post-discharge care arrangement are in place, we make sure that they go to the appropriate level of care to make sure that they can actually have the most services that's going to get them back to their prior level of functioning. And of course, we do communicate with family members. We keep them in the loop as far as what's going on with their loved one. I use a great software where I can easily send access to the family members, and they are able to go in there and see everything that's going on, when the next appointment is due, what medications they are on, when they are going to the doctor's office. So basically, even calling me, if they don't need to, they get home at 10 o'clock, they want to go and look in the chart, they already have access to that, so they are able to see everything that's going on with the patient.
That's great. And, we talked offline about this. You were talking about how, it's a family in New York, their elderly parents are down here, and, they have to work, of course, and maintain their family, and they can't come down here every time mom or dad's in the hospital or there's a situation. You're kind of like that family member that lives in the neighborhood and stops by.
Exactly. And also there are local families that, their children, they work, they have kids on their own, and they are dealing with life as we all are. So, and of course, the healthcare system is so complex that it's very hard for people to understand where to go. So that guidance that we are able to provide as healthcare professionals, we are able to actually quickly get that person back to their prior level of functioning or something close to that, as it permits.
Yeah. So, Jackie, remind folks, just give us an overview again of what, both Elite Home Services does. I know you said some psychiatric nursing.
Oh, absolutely. So we do everything from skilled nursing to physical therapy, occupational therapy.
And skilled nursing, why don't you define that?
Basically, we can do diabetes teaching, any type of vital signs. We go out and check with the patient. We're constantly doing PTI and R monitoring. We can do wound care monitoring for their wounds, and also wound care. We do Foley catheter care. We do IVs on certain occasions. Like if a patient is in need of an IV, the hospital is able to discharge them home safely. We go out and administer the IVs for them. And we do basic, if they have a new diagnosis, we go out and try to help them with their new condition.
Speech therapy?
Oh, absolutely. We do speech therapy.
People have strokes, unfortunately.
And that's something that we do a lot of, actually.
Yes.
We do a lot of the speech therapy. So, and we have, like I said, the therapy portion of our program, and we have social workers, and then we work in contact with geriatric care management companies like Kitzia's.
It's great when you network and you have the right people.
We do.
Give folks your phone number again, and where
I'm going to
you're-
give you the 800
Yeah.
number. It's the 1-888-422-3578. It's Broward, Palm Beach, and Martin, St. Lucie.
And Ketsia, one more time, give folks your contact info.
954-446-7022. We do offer a complimentary 30-minute phone consultation. So if you have any questions, be proactive. Do not be reactive to situations. We are able to provide you with practical solutions to all of your care management needs. So give us a call, and we'll be more than happy to assess your loved one and provide some solutions.
And that's how I'm going to end the show, with those famous words of Ketsia. Be proactive, not reactive. Get the right care for your loved ones.
Thank you for listening to the Elite Home Healthcare Show. Elite Home Healthcare delivers care to you or your loved one in the familiar comfort of your own home. Medicare pays 100% of the costs with no copayment and no deductible for qualified homebound patients. Elite Home Health Services will develop an individualized plan of care to meet your specific needs. Skilled registered nurses and physical therapists will plan and implement your care, along with your participation and your doctor's guidance, assuring a plan specific to your needs. We'll make multiple visits to your home over weeks or months to make sure you are recovering according to plan. For more information, call us 888-422-3578. Join us for more information and news on our next show.
Diamond Princess